Dimitri, Georgi, thank you for joining me for a short discussion. We are at the Digital Health Excellence Forum in Frankfurt, where you two shared your thoughts about the impact AI is going to have on the workforce in healthcare. We talked about, is it repurposing, reskilling, or doing something else completely? Dimitri, maybe we can start with you and your observations. So you worked for the NHS, you worked in the private sector, you now work in the community setting for the NHS. So where do you see the actual impact of AI on the workforce already?
Sure, it's great to be here. By and large, it might be things that are already in train everywhere, little by little, not universal and not at the same length and extent, but by and large, it is replacing tasks that are currently done. It's the wraparound around the consultation between a patient and a clinician. Things that need to happen before the patient booking an appointment and all the administration of engaging with the admin team to arrange that. The doctor or nurse or allied health professional and everyone else going through hundreds and hundreds of pages, PDF, or looking through 3-4 different patient records to find all the information they need before a consultation. So much of that can be supported through the use of AI, let alone what happens during and after the consultation, through supported triage, clinical supported decision tools, but then also the summarization of the consultation, the next steps, and all of the next steps that follow a consultation. Now, that's great. But I think just as important and just as interesting is what does that release time to do differently? I think it will release time for healthcare systems, not only the individual doctors, nurses and others, but whole health systems to think about what's missing now from healthcare. And it's the long-term condition management, it's the case or care management of patients with complex multimorbidities. It is things like that, supported still by AI, but actually we will have more nurses and others who can take a lead and thinking of population health and prevention.
That's kind of the ideal or optimistic scenario. Georgi, you are the Chief AI Officer at Hospital Zdraveto, and you mentioned something interesting, and that is that you want to get rid of the keyboard and the mouse, but clinicians aren't always interested in that. Can you elaborate?
Mm-hmm. Yes, that was a good point. So, yes.
Just put it closer.
Oh, yes. Yes, thanks for the question. Yes, I am Chief AI Officer at Zdraveto, and also I have to say that Zdraveto is collaborating with a company Vector Labs, which is the power bank behind the data science, and I'm also a partner there. So yes, the doctors, we expected them to be extremely in favor of the new technology, and surprise, they are not always. Although it is supposed to help in the long run, of course, but there are some concerns. There could be idiosyncratic concerns, like if I'm reported or the visit is reported, how the AI can interpret that, shall I be liable for something else, etc., etc., or maybe it will not save some time, but maybe I will have even more burden. Things like that. Always the technology is not met with the best enthusiasm, although the data scientists and IT and management think that it is straightforward, that it helps. But the reason is that if the doctors have not asked for something, they will initially be reluctant, and that's understandable. And the most innovative ones will prove that it helps them, saves time, and then maybe the adoption will be easier.
Mm-hmm. Dimitri, speaking of adoption, you distinguish between three things. Usually we talk about technology and the implementation, and that how implementation is done is going to impact the actual usability of the solution of any technology. But you also distinguish between implementation and everyday use. So how things changed after the implementation phase when things go to business as usual. So how do you see that AI will be used there, or how is the fact that we still have challenges with usability of technology that's dependent on implementation going to impact AI adoption in healthcare?
Sure. I think we've had, and speaking from the UK or English NHS perspective, having been through such a big program of implementing electronic health or electronic patient record systems, we've seen time and time again the amount of effort being put in implementing them, but then you see the optimization phase being just as important, because that's when actually the real use of those systems takes place. All too often, the staff revert to using paper where they can and working around the electronic health record system. As a workaround, you might think, well, it might be good enough to then take the paper and scan it and put it on the record, but that just doesn't cut it. And there's been far too many such lessons about how day-to-day use doesn't go as easily or as swimmingly as you would want. To now be prepared for that, for the use of AI. And that's why I think with technology, and maybe this is something that we should all have been doing already, we really need to bring into the day-to-day implementation and embedding of technology, and AI more specifically, the whole agenda of quality improvement, transformation. There are teams in hospitals and elsewhere in healthcare who are responsible for making sure that the service focuses on improving outcomes, processes. I think it is time to bring them to the forefront and work with our quality improvement colleagues to make them part of digital transformation, rather than digital transformation and AI being something that IT does.
Mm-hmm. AI is widely used already on the clinical level, even if it's not used through solutions that would be embedded in EHR systems. Doctors use AI, they might use ChatGPT or other solutions to ask questions. And one of the topics, therefore, that we discussed was how do we upskill and also regulate the technology. Georgi, where do you see the options for that? Should it be obligatory for clinicians to get some training or on AI? Do we expect that each hospital is going to have their own guidelines? What do you see as the potential solutions?
So there is indeed such a trend that the doctors use ChatGPT to make them to help them with diagnosis and maybe with therapy, which is a gray area, of course. Will we or the doctors have to use such technologies for this purpose? Now, this is very interesting because the doctors, they are reluctant to adopt, as we spoke, some innovations that will help them with their work and time, but they're not reluctant, and they use, even under the table, such devices as ChatGPT just to help them with their diagnosis and work. Now, rather than trying to stop this trend, let's try to legalize it. This is maybe the trend now. And one of the ways is to make short programs for the doctors to be certified what are the risks. And once they get something like a certification of what is the risk of using such open source technologies, the risks and benefits, then the best practice, I think, should be to have on premises such LLMs, and all the flow and everything the doctor is using and putting into the chat is recorded, and then we know that it is traceable. Other doctors can learn from it, both positive and negative consequences. But because now it is under the table, you miss the link between symptoms and solutions. And this is terrible. It better be legal and the doctors aware rather than hidden.
So basically, if we kind of demystify the use of AI, we could leverage even more benefits from its use.
We can have, yes, that's one thing. And also we can even learn how to improve it based on the doctor's reaction. Maybe the doctor does not agree sometimes with the LLM, and then the LLM learns from this experience.
Dimitri, do you see any such initiatives for, regulating regular tools in the UK? At the same time, there's also clinically validated solutions such as open evidence that clinicians can use freely, for example, instead of ChatGPT. But I don't know what your observations are.
Yeah, the beauty of shadow AI, shadow IT more widely is that everyone is willing and happy to do it because it makes their life easier. And the use of ChatGPT and other equivalents in an unregulated manner is one of those occasions. It is, of course, entirely inappropriate, but it is done. People are voting with their feet and using the tools that they can. Now, I think one of the problems, of course, with regulation is that once you make it the responsibility of a clinician to use a tool responsibly, suddenly you are burdening them with the responsibility, accountability, liability for using these tools, and hence the shadow IT approach instead. The problem with the liability issue is that we're passing the buck effectively to the frontline clinicians and saying, well, this tool is regulated. It should do the job that it says on the box. Go ahead and use it, but guess what? You will be responsible, and it's your job to make sure that it works. It's your job to sense check that it does what it says it does. And if there is any adverse incidents over time, you should report them back to the manufacturer, to the relevant regulatory body in your country, and your hospital safety and other hazardous reporting team. That is a lot of effort that we're expecting, and cognitive bias actually, that we're expecting clinicians to take on. And I'm not too sure whether it's as fair to basically bring a human in the loop, as we say, and expect them to be the one that bears the burden. Having said that, of course, what we need to make sure is that we create the right frameworks for regulating AI, but not assuming and giving all the responsibility to the frontline clinicians for using AI on a day-to-day basis. Some of that needs to sit somewhere else.
Georgi, how are you tackling digital literacy in your hospital? AI is developing so fast that even developers themselves can't test all the capabilities that they invent. And yet here we are, talking about agentic AI and looking into what's going to happen if each doctor creates their own AI agent, because with wipe coding and new tools, you can use 2-3 prompts and have an app. So that's very empowering for some and super scary for others. And all the doctors are even saying that they will rather retire than deal with all the technology. So how are you tackling that issue?
That's a very interesting issue, unexpected for me, because what you could expect such tools as ChatGPT or coding programs like Lovable, for example, to be used more by data scientists, maybe young data scientists who will make their own work faster and will jump from their platforms where they're coding to such more like vibe coding, etc. It's absolutely not the case. It is like also unexpected maybe for some. So the digital literacy goes like this. So the CEO wants to be the most digital literate and to try everything with Lovable, etc. So the head of the hospital, yeah, because he has a stake to have better management, build management apps, to try out things that it will take him 2-3 weeks to explain to IT department what exactly he wants, because he's the doctor. But he can explain much easier to the LLM model what he wants, and then build an app and then post it exactly on a website without any effort, without coding. And now the data scientists, they are really afraid of that. Because, well, they're afraid that these apps, actually, the doctor will give the apps to the data scientists, then the data scientists have to debug these apps and make other apps. And they say, no, we are not debugging code from somebody else that we did not initiate. That's a nightmare, impossible. So now these two, let's say, trends are converging a little bit. Mm-hmm. Now what happens is the doctor is making a prototype, and the code, let's say, from Lovable is taken to the data scientists, but they put it in their own environment, whatever they like, and then compile and run. Still, we are converging, because the doctors, whatever they give to the data scientists, they call it production ready, which makes them, makes their hairs go up. But at least there is some conversation, and for sure we see that it saves time. So at some point, the time is running in such a way that such tools, they will become faster, they will become less and less transparent, but they will do their job. Like in our days, when I was a data scientist student, I was reluctant to use a code of machine learning that I did not write myself, let's say in MATLAB or C++. Now, of course, everybody is using, let's say, scikit-learn in Python without checking the code for the machine learning. So we are going in such a direction, and it's interesting what will happen.
Yeah. One thing that we came to in the discussion that we had previously and got me thinking was, when we start to optimize, when AI starts to take notes instead of the clinician summarizing and organizing their thoughts, we are also reducing the cognitive burden on us and potentially reducing the strain that is needed, for thinking, for creative thinking, for figuring out new solutions. So I'm kind of wondering, are we going to be less intelligent, and we really are going to become just interfaces between AI systems where the clinician is simply going to be gathering the information from the patient and feeding it into the AI? So what do you think of that kind of future or consequences of AI use for healthcare?
Yeah, so it's a little bit technical question, but I read recently that like in the 50s, the previous century, the first programmers who were programming only in the machine language, when the first language that came assembler, which is still very technical, right? But when this language came with a lot of abstractions, etc., the programmers said, oh, now the IQ of every programmer is going down because they have a high-level language to program on, right? So, and if you define IQ as the ability to program with zeros and ones, it is certainly true. So now, if you define programming as programming with commands and not programming in English, it is certainly true. But maybe in the future, programming in English will be enough.
Yeah.
So
that kind of makes me feel a little bit better. It's also true that, just because we have the tools, it doesn't mean we know how to use them. Prompting is an art. And, if you don't know what to ask, then you're stuck.
Yeah.
So that's, I guess, good news.
Yeah. You know what? Galileo Galilei, he was producer of glass, and that's why he could make the telescope. Now, I bet not all astronomers know how to produce glass, but they're very good astronomers, right? So,
yeah.
And they have well, maybe still lower IQ, but still comparable.
Dimitri?
If I can add to this, I guess if I was thinking of the clinicians rather than the data scientists, are we de-skilling? Maybe we are. But maybe what we will do is become more specialized or specialists in our respective fields. And actually, maybe it will also allow doctors and other clinicians to become more human and humane in their interactions with patients, moving away from where we are at now, where the doctor sits behind one or two or three screens typing away. And actually, maybe what we're also going to have to confront is the fallacy that actually, do doctors ever really contain the whole knowledge of everything and anything to do with medicine in their brains? No, they weren't. They might act as if they do, but they never did. So maybe we are better off with AI being that the supporter of a decision, because they can access all the latest evidence from the whole of medicine.
I guess, where I was coming from in this thinking was simply also from the fact that AI has helped me a lot, with the podcasts, with how quickly I can edit them. But still, I don't want to offload that to someone else, because if I just have the discussion when I have the discussion, instead of re-listening it, rethinking what people said, I think that my knowledge kind of changes the level of retention, and when you listen to things twice, then you see other things. But I like the fact that you see that the role of clinicians is potentially going to change, because one of the things that was also mentioned today is how many gaps we still have when specialists only think about their specialty, and it's expected for patients to be their own case managers and kind of connecting the data fragmentation that is still present in healthcare. So maybe another last technical question. When we talk about AI and its capabilities that are running or increasing exponentially, it may seem that we're soon going to solve all the problems. But then if you talk to any IT person, they're still going to have a headache when you start talking about data standards. So where do you see the role of AI in data standards? Is it going to just create more problems if we start using AI agents that are not interoperable, and now we're going to have the interoperability problem number 2 or 2.0 with AI agents? Georgi, maybe you can start.
Yes, so here the question is, once we have a lot of agents, then maybe we build another agent to standardize what they talk about, and then we go level up, and this never ends. But maybe that is better than having it right now. We don't know. Because 15 years ago, we were talking about that all the medical data will be clean in databases, and we will avoid the situation where the clinical data used for research, etc., is like only 3%. So 97% is not used. Today, in one of the lectures, we heard that now, 15 years later, the percentage of data not used is the same, 97%. So obviously, something has to change, and there is a very big potential, as you see. If AI can help in any way to standardize, even with 1%, this is still an achievement. We don't expect it to solve everything, but we have some initial data already that we see that from different legacy systems, the AI can extract the same type of information with some success, but it is still kind of standardization, and it is much better than just having the data lying somewhere. If it lies on a paper somewhere in the basement or on a hard disk, then nobody accessing it, it is exactly the same thing.
Dimitri, do you have any last thoughts on this topic?
Yeah, two actually. First, hopefully, what we might achieve through the use of AI is move away from the need for structured data, because we will be able to allow data to sit in its dirty, unstructured, native nature, and AI will be able to pick out the relevant bits for us. The second point actually is absolutely the issue with interoperability and data flows. The more we create bottom-up agents and implement AI, the moment one of the data that flows from A to B to C, somewhere in the organization or the complex array of organizations that constitute healthcare provision, if the AI is going to break, it might be too late by the time we realize that. And when we rely on humans, we're a bit more aware of how data flows from A to B, because somebody needs to manually copy it from an Excel file and put it somewhere else. AI might not actually notice that something is missing.
So we definitely will still have plenty to do. Dimitri and Georgi, thank you so much for sharing these thoughts, and we'll see what the future brings.
Yes.
Thank you.
Thanks a lot, Tjasa.